Senator Aisling Dolan.
Thank you so much, Chair. And I suppose just to welcome all of our speakers here this morning and online with us as well. It's been quite, I suppose, it has really been sort of shocking, I suppose, some of the statistics that you've mentioned and the impacts, I suppose, particularly in the areas that you're experts in. And I suppose I just have a number of questions, so I might just go through a few here. But again, just to say thank you, I know to our opening statements, I know to Ms Paula Leonard, National Lead from Alcohol Forum Ireland, Mr Hugh Greaves, I suppose Coordinator here with Ballymun Local Drugs and Alcohol Task Force, and for Mr Jerry Cooney, I know Senior Addiction Counsellor of the Rutland Centre. It is a stark outline, I know, of the impact to people and to young people, I suppose, with alcohol and drugs. For me, as everyone would know here very well, I represent, I suppose, more rural and regional areas, you know, in Roscommon and East Galway. But there is a lot of alcohol and there is a lot of drugs in towns and villages all around Ireland, as well as in our urban centres. I suppose I would have lived for many years in Dublin. I lived in North Circular Road, close to Summerhill, and I would have worked in Glasnevin. I would have gone to the swimming pool in Ballymun, and I would have worked a part-time job in Finglas many years ago. And I would have worked with communities there, and I would have known the strength of community and the pride in that area. And I also understand the immense challenges that are in front of so many people and young people in that area as well. Some of the points that you raised here, you spoke, I suppose, firstly, Paula, on the Alcohol Forum. I mean, the level and impact of the 24-hour drink delivery on young people. And I know the culture and attitude to alcohol can be so dangerous. I have checked here, and it's been confirmed, as you've mentioned, that they're going to publish a general scheme of the new sale of alcohol bill by the year end. The points that you've raised there, restriction on delivery and also the easy access to alcohol, are key points that need to be raised, and I know that that's something that they are considering in putting that together, and we'll have more opportunities to discuss that probably later this year. You've also highlighted the Global Alcohol Action Plan and the World Health Organization. I think it's a SAFER initiative that you've mentioned. I think those are all really, really key points. Secondly, just for Mr Greaves, I mean, I know the breakdown, as you've said there, of family connection, I suppose, during the lockdown, the influence maybe that older members of families, the grandparents, would have had on younger people, I think would have been crucial maybe in some ways. Maybe those connections have been lost, and I'm sure that grandparents play a huge role with young people as well, be it childcare and everything else from a very young age. You've spoken there just about safe community spaces to study, I know, access to devices. I know that there's funds that have been allocated through the ETVs. I'd be curious just about how has that been promoted within the area there? Are families able to access any of that? I suppose I'd also just have a few questions around family resource centres. How do they operate in the areas that you're in as well? I suppose within Ballymun and within other urban areas, how are those linkages happening? I suppose just for Paula, just you spoke as well about domestic abuse, I think, and the parent helpline, if I'm correct. And you talked about coping mechanisms, and you said the evidence here is the rise in requests for barring orders. Again, just in relation to that, now that society is opening up again, are there changes happening, or is it still continuing at the same level? I'd just be curious. Are we still seeing the same rise in barring orders and engagements, maybe with the guards and so on? If I might ask Dr. McMonigal, Helen, is that right? Maybe, I'm not sure. Yeah, Helen, thank you so much. Yeah, just in relation to, you mentioned the multidisciplinary area. I suppose I would have worked in health innovation and so on previously, but when you talked about multidisciplinary, how are you linking in currently with the public health under the CHOs? And I'm assuming it's CHO1, I'm guessing, in your particular area and under public health. I know that I've had loved ones as well that have gone through sort of alcoholic abuse, I suppose, and even locally I'm working with somebody whose partner increased their drinking all throughout the lockdown and now is dealing with sort of early onset dementia, alcohol-related dementia, which is incredible. And you know, that person, they're in their 50s, probably late 50s, you know, and it's an awful, it's such a toll on the family as well as the person who is enduring this as well. So I suppose just, I would like to understand a little bit more. You've mentioned the National Working Group. You've talked a little bit about mixing addiction psychology and neuropsychiatry services. Maybe if you just wanted to expand on that a little bit, I'd really appreciate it. And Gormagat. Thank you.
So who would like to come in? Hughie, would you like to come in first, and then maybe Paula and Helen?
Yeah, well, the ETBs and the promotion of increased tech facilities, I couldn't answer it, to be honest. I'm not aware of it being promoted locally, so maybe perhaps it is. So I'm not aware of it. So
what's really strong with your group as well is that, you know, you've mentioned that it's a mix of residents and you're a task force, and you're also dealing with associations and, you know, I suppose local representatives. But I suppose maybe promoting those areas might be strong for your local community as well, yeah, perhaps, would it?
Absolutely. In terms of the family resource centres, yes, then they did, as I said, we are a partnership of agencies, as you mentioned, and they are, the local family resource centre is one of our partners, and throughout the lockdown they were very involved with families delivering food and trying to, as best they could, they would have provided services like communion dresses for families and that. So there was a great connection to families that really needed it by using those as a means of engagement.
Connection.
Really. And also families obviously benefited from the not having to spend €400 or €500 on a dress. So with the lack of removing that, sort of took away one of their big connections with the families that really need that support. So the food deliveries became a huge thing where agencies partnered up to access food banks and to get to people's doors and stuff like that. So they continued. If anything, it showed that there's a need for serious more investment in family resource centres.
Thank you.
They're on the ground in the local areas that they need to be in, and they do provide that
connection.
Thank
you so much, and thank you. I was just reading while you were speaking there. I just remembered you spoke about how you connected with walk and talk sessions and balcony chats, and I just thought that was so innovative, you know, that you really got out there and into the communities. So thank you very much for all of that work.
Respond.
Yeah, thank you very much. Just on a couple of points, I suppose, raised by the last deputy, who had emphasised the fact that you represent rural areas. I think it's really important to acknowledge that the supports of Alcohol Forum Ireland are delivered across the border counties, with the exception of Louth. So, you know, Sligo, Leitrim, Cavan, Monaghan, Donegal. Those counties along the border necklace in the Republic of Ireland have twice the national rate of poverty, according to, you know, the new spatial data that has come out, roughly 22% poverty. I think it's really important that, you know, there were absolute downsides: isolation, increased drinking, problematic drinking. We don't know what the long-term outcomes of those will be as a result of COVID, but there also were some innovations. You know, they talked about the balcony chats. Not a lot of people probably in our area had balconies, but what we have seen is that, you know, our experienced family practitioners pivoted to sort of online delivery and phone support and all of that. But what we did find with one of our programs called Hope, which was Have Only Positive Expectations, where they were meeting with families who were in crisis throughout COVID, and it was a 6-week evidence-based program. What we did find is that we were able to deliver that to people in rural areas that otherwise might not have been able to attend in person. So I think that the future needs to look blended, and we need to think about either innovations for rurally dispersed and rurally isolated families who may experience different types of isolation. So I think there's some opportunities too that we need to look at in the future. In relation to the proposed sale of alcohol bill that was discussed, I think it's absolutely essential that 3 things happen with that. One is that we do provide for drink deliveries. Part of that will require us as a country to look at what does proper age verification look like. There's an opportunity, I think, in that to also look at proper age verification for online gambling. As has been raised here this morning, I think that's really important. You know, at what point do we do it? How do we provide information around identification and age verification online? Are there secure ways of doing that? How are we protecting young people? I also want to talk just very briefly about what we are very concerned about it at a community level in this country, and we're concerned about a number of the recommendations that are in the Nighttime Economy Task Force report. I think there's a lot in it that's really welcome. They're saying that we want to have a nighttime product that isn't overly dependent on the sale of alcohol or chaotic drinking. However, there are provisions within the Nighttime Economy Task Force report that recommend that there would be extension in the number of hours that alcohol has been sold and in the number of venues that alcohol has been sold. That is completely going against the grain of all of the international evidence that the World Health Organization would cite, that basically says there is a fairly simple relationship that if you increase the availability of alcohol, you will increase the harm from alcohol. You will see increased hospital admissions, you will see increases in antisocial behaviour orders, and you will see increases in nighttime violence. So I think it's really important that after today that people do consider what actually ends up in the sale of alcohol bill and what bits that we can leave. I mean, we really, really welcome the fact that government is now considering consolidating alcohol licensing law. That's something that really needs to happen so that communities, so that the Gardaí and so that licence holders are very clear around what is in the law and what their responsibilities are.
I think it might be up in my time here, so I'm conscious that we have to allow other speakers in as well. But thank you so much. I know you're very passionate about the topic here, and indeed there are high levels of poverty and disadvantage, very much so in my own areas as well, so it is fairly crucial. One thing I would say is e-health, or I suppose how we engage with people using telehealth is going to be so important going forward, and we maintain webinars and online access, particularly for rural areas. Thank you so much, Chair, and I understand, I don't know, is there time for Dr. McMonagall?
Helen, would you like to come in there briefly on what Senator Aisling, would you like to give?
Yeah, absolutely. And thank you for accommodating that, Chairwoman. I think just in terms of the multidisciplinary and interdisciplinary approach required for alcohol-related brain injury, I think that while addiction services and acute services have a really crucial role to play in the prevention and the early identification of this condition, you know, rehabilitation, meaningful rehabilitation and sustained recovery and quality of life and supported independence will never be achieved with this group without the inputs of specialists in neurorehabilitation. And currently, addiction services and services for brain injury or neurorehabilitation exist as distinct service entities with little cross-sectoral collaboration, and that can't continue. You know, brain injury teams and addiction teams working together could provide the core skills required to provide ongoing rehabilitation and support for this condition. And I know why we're here today to talk about addiction, the reality is that addiction is causing brain injury. You know, as many as 35% of people dependent on alcohol will develop an alcohol-related brain injury. Between 24% and 50% of traumatic brain injuries are caused by alcohol. So we work in the addiction sector. We have a really important role in advocating for better provision for people who develop brain injuries, and we need to have a really strong desire ourselves to be neuro-informed, given the prevalence of brain injury within our own services. But I think also as well, we need to be willing to play a role in advocating for greater provision for people with alcohol-related brain injuries in Ireland as well. Both areas, brain injuries and addiction, they're chronically under-resourced, but particularly in relation to brain injury services, I believe the government needs to address the chronic underinvestment in neurorehabilitation as a whole in Ireland, which is a persistent barrier for people with all neurological conditions, including those with alcohol-related brain injury. And I would definitely mirror calls from other agencies, including the Neurological Alliance, the Disability Federation of Ireland, to name just two, to address the huge dearth of appropriate regional, residential and localised neurorehabilitation services in Ireland. And these specialist services, they're a really important component of recovery from an alcohol-related brain injury. You know, what we're talking about here is a condition that has a high potential for recovery. So over 75% of people with alcohol-related brain injury can make some degree of recovery. Over 85% of people can be supported to live in the community independently. But what underpins that happening is the provision of specialist residential rehabilitation. And that is best supported by a joint working arrangements between brain injury services and addiction services. Just as well, you mentioned around the national working group as well. You know, I don't want to oversimplify the issues associated with alcohol-related brain injury. They are complex, they are nuanced, they are influenced by a myriad of interconnected and interconnecting systems. And, you know, most fundamentally, that social problem, that is a product of a network of cause and effect between multiple different systems. And if we want to act to improve the responses for alcohol-related brain injury, we need the coordinated action of many people, many systems, many directorates working in a networked way across different organisations and different service areas. And that's what we need in order to progress with the national working group. We need buy-in from mental health, social inclusion, disability, in order to begin to have a conversation about, well, what are the key barriers that we're experiencing in relation to alcohol-related brain injury at the moment, and how do we move that forward?
I really appreciate it. Apologies, I just understand. I know that the time is very tight. One thing I would encourage, I think that research pilots are crucial here. When you're looking at multidisciplinary groups, it's not a case that funding just arrives automatically. We need to show the evidence behind it. I would potentially ask for another maybe response at a later stage, or that you might provide me with it. But, you know, what groups are engaging with our universities, within our departments of health and departments of nursing and so on, in relation to building this multidisciplinary group? What access to European funding is out there that we could use to build a pilot that we could roll out in a particular CHO, working with HSC, working with our colleges and working with our key researchers? I think that's the way to start something like this, the ball rolling.
Thank you.